of the pacing teams at the 7th Annual Metro Health Grand Rapids Marathon is a proponent of pickles as a health benefit for distance runners. Dr. Rick, can you explain why?
Yeah, I've been a user of pickle juice for a long time now. I had several marathons when I first started running where I would cramp late in the race. It would be very frustrating. I would have at mile 20, I'd feel good, ready to go, and my calves would just be in a knot, and I couldn't run. And I would walk to the finish, and it would just be a really frustrating experience. A friend of mine who's a trainer suggested maybe I try using some pickle juice. I guess weightlifters do that when they go to competition, and bodybuilders do it in competition to prevent cramping in their competition. So I tried it, and I didn't cramp. So I did that for about 10-15 races in a row. And what I would do is I would take a jar about this size, and I would just sip on the pickle juice for about a day or so before the race.
And people would look at you funny or wonder?
Really funny, yeah.
Okay, good.
Especially if you happen to ride the bus to the start, like in Boston, you're riding a bus and you pop open a jar of pickle juice and
draws a few odd looks
in front of you. Yeah, it's very memorable. But so I did it for a bunch of races. It really worked for me. Then I didn't do it for a race, thinking, oh, this is probably an old wives' tale. There's probably nothing to it. I didn't do it for a race, and I cramped again. This is after I've been running for years and years at this point. So that's when I realized there really has to be something to this. So I've been doing it ever since. I've done several ultra marathons using this regimen, and I never cramp during it. There's a company that makes a pickle juice sports drink based out of Texas that sponsored our race for several years. And they changed their formula last year, and it's a little more watered down. I don't like the new formula as much. So this year we sought out a new sponsor, and I live in Holland, Michigan, and the Heinz pickle plant is conveniently located in Holland, Michigan. And I called their plant, and I got in touch with the plant manager, Dr. Jerry Shout, who is, I'm not sure what he's a doctor in, but I think he's a doctor of pickle science.
I would hope so.
Yes.
A booming specialty.
We had this amazing conversation for about 20 minutes talking about the science of pickle juice. I always knew it was loaded with sodium. It's also loaded with potassium and calcium, as well as magnesium. Did you know that chlorophyll is loaded with magnesium, but it's bound to the chlorophyll? And when the pickles ferment, the chlorophyll breaks down, the magnesium is freed, and pickle juice is actually high in magnesium, which is also an anti-cramping electrolyte. So really, it's got it all in one package. I love it. I drink it before races. If I can get it during a race, I will drink it. Usually it's not available, but at the Grand Rapids Marathon, I think is the only marathon I'm aware of where pickle juice is available. We serve it at mile 15 and 19. There's one aid station that you pass twice. It's because it's an out and back section of the course. And so you get two options, or two times when you can drink it. Interestingly, there was a study done at BYU just a couple of months ago that was reported on the New York Times just a few months ago, where they exercised healthy volunteers to exhaustion, and then they induced muscle cramps, and they gave them either water or pickle juice. And the ones who got water, the cramps were sustained, and the water did nothing to break the cramps. The ones who got pickle juice, the cramping subsided in 85 seconds, which dumbfounded the researchers, because that's not even time for the sodium to get absorbed from your stomach, or any of the other electrolytes. So now there are theories that it changes the pH of your stomach, which leads to a change of hormonal balance in your body. It's very complicated, and it's really not fully understood, but it's been clearly demonstrated scientifically to help prevent muscle cramping with endurance sports. So I am a believer in it. We do it. I think it's something that, 20 years from now, it may be standard that's offered at all races, and we can say we were the first to do it.